one thing I really like about Queen's Internal Medicine is the collegiality that comes with the program. You're a small to medium-sized group of residents, and we all get to know each other pretty well. At work and outside work, we all live pretty close by. It's a popular area in downtown to live for most residents, and so within the program of internal medicine and in other programs like family medicine, pathology, we all sort of get to know each other because you see each other pretty much weekly, if not daily, and it's really, really easy to make friends, especially if you're not from Kingston and you don't have many roots here.
The city, I think, is wonderful. It's a beautiful city. We're right on the water, which I think brings me an endless amount of joy. The amount of restaurants that are delicious and great places to shop. I think something that can't be beat is that I'm a 7-minute bike ride from work, and I think you'd be hard-pressed to find anyone who works in the hospital who lives much further. I don't waste any time commuting, and so you get to spend the rest of your day outside.
One thing that's really great about Queen's is when you're on CTU, you get to see patients with GI issues, patients with respiratory issues, patients with nephrology issues, and you really get great exposure to just general medicine. And I've really enjoyed that about internal medicine and also about Queen's overall. And because it's a really, really great teaching environment for a very wide variety of presentations. And I think that's what drew me to internal medicine in the first place.
The clinical teaching we have here at Queen's is absolutely fabulous. I've worked in a number of places in the US and Canada, and I can say assuredly that the teaching faculty we have here are second to none. They really provide some of the best teaching I've seen.
We spend a lot of time getting to know the patients, and then we take what we learn about the patients and we really try to do some detective work and make that into diagnosis. And it's always centered around what would make the patient feel better or how we would help the patient. And I find that you get to spend enough time knowing the patients and following them that you feel like you're participating in their care.
This is, I think, one of the few training programs in which the faculty will know you by name and you'll know the faculty by name. There's a real close relationship there. This creates really an excellent, safe learning environment. And because there's that personal relationship, it makes it safe to ask questions, to expose your weaknesses and really focus on your growth.
A typical day for us would be meeting in the morning, figuring out what you need to focus on for the day with patients. I think it's a good day when I spend the majority of my time with the patients and sorting out what I need to do for them to help them and which specialists I can call to involve, how I can further their care. And then we always meet again. What I love about internal medicine and what a typical day involves is that you're always brainstorming with other people. So running the list or chatting about your patients with your team is a huge part of our day. And I think that's such a great learning experience, and you feel supported in that, and you have thought-generating conversation, and that's normally how we really further patient care.
I think being in medicine, it's nice because you always feel like you're learning. And often we think that when we're medical students, we're learning and then we progress to residency and learning's over. When you become a staff, learning's over. But I don't think that's true, and I've realized that now. I don't think I'll ever stop learning because medicine changes pretty fast. And so the learning never stops. And I think that's something that, regardless of whether you're in internal medicine or something else that you chose to do, I think that's one of the key things that I really enjoy.
The advice I'd give to incoming residents coming into our program is to realize residency is not that long. It's a short period of time in which you're going to get a lot out of it if you put a lot into it. And I mean that not just in the clinical learning, but in the whole life experience. You really have to throw yourself into residency and not have the inhibitions about how you're going to look, how you're going to be perceived. Enjoy the people, enjoy the time, work hard, and have fun.